Hi, today we will discuss cervical manipulations. If you are against it, I would advise you to leave because you might get angry with watching what I have to show you today. Good, you're still here. So what are you going to watch today? I'm going to present research showing how often and how prevalent adverse effects are in manipulations. I'm going to show a case report of a bad reaction that happened, and I'm going to show a news report that is probably what you see most often. Well, before we go into manipulations, let us look at some statistics from the medical world of giving drugs and medications to clients. So this review has looked into 33 different studies taken in primary health, in primary care settings. They were looking at the adverse drug reactions, which means the patient got a drug and they had a very bad reaction to it. All in all, the study found there were 8.32% of adverse drug reactions, of which, and I want you to be with me, 22.96%, which is almost 23%, could have been prevented if the proper drug-to-drug reaction would have been considered and something else would have been prescribed. Almost 23%, that's almost quarter of all the cases of reactions that happen. Now let's look into manipulations and the statistics and percentages in there. The leading fear factor of neck manipulations is cervical artery dissections. This study has checked 9,021 cases of adults in the age of 65 plus. The bottom line of the study was there is no significant difference and there is no correlation between the neck manipulations that some of them have gone through and the cervical artery dissection. We looked at the older population. Let's look on the more normal population. These two studies have looked into the populations. One found there was no adverse effects. The other one found that there is a chance of less than 1 to 100,000 of getting an actual adverse effect. So far we've seen statistics of manipulations alone. Let's look on manipulations compared to mobilizations, which mobilizations is considered by everyone a much safer technique to do. So if we look on the adverse effect of vomiting, disorientation, and confusion, you can see the manipulation has less occurrences compared to the mobilization or the mobilization and manipulation group. However, the study concludes there are still no adverse reactions at all through any of those modalities. Let's look on the other side of the coin. This study presents two patients that has been to a chiropractic adjustment on the neck. They both had a carotid artery dissection, and both of them had an ischemic stroke. So far, we've looked at research. Chances are you have never seen and you won't even read the research. So let's look at the stuff you actually are exposed to. This news report, for instance, of a 29-year-old that dies after a chiropractor cracks her neck. Or this news report of a 28-year-old that is now paralyzed. Or this news report of a woman that says that the chiropractor made her very sick and it was just the beginning. Or this news report that says that cardiologists are raising alarm for neck manipulations. These are all news reports you are most likely seen and kind of got into your head saying, do you know what? Neck manipulations is not the way to go. Yes, these cases are tragic. Yes, they happen. I wouldn't lie to you and say that it's all safe. But they are very rare, very uncommon, and statistically speaking, they are hardly even happening. Of course you will see about those cases because these are bad things that happen, but you wouldn't hear about the other 10,000s that don't occur, that people are actually getting relief out of. So my advice to you, go to a therapist that knows the craft. They will do the correct orthopedic testing, they will make sure that you are okay to go, and they will reduce and minimize the risk of you getting any injury from a neck manipulation. I hope you enjoyed this one, and I'll see you in the next one.